Hello, my name is Michelle Morand, and I am your host of Cancer Just the Facts. This is a program for you if you are a cancer patient or patient advocate or physician, healthcare provider, and you really just want to make sure that you are as well educated as possible about the most current science-based medical facts about cancer, cancer diagnostics, cancer treatments, alternative therapies, all of the stuff, and about how best to speak to the people in your world, your healthcare team, to ensure that you get the care that you need. That's what this course is all about. And I'm open to your feedback. So as you go through the course, if you see anything that you think could be more clear, done better, or feels like it's missing, or you have some information that isn't in this course you think would really benefit people, don't hesitate to shoot me an email or post a comment associated with that unit and let me know. I don't know everything. I do know a lot. I've been doing this for 14 years, helping cancer patients all around the world to access better treatments than their doctors are currently providing them within their cancer agency. So without having to travel, without having to change doctors, all of that good stuff. So I've got lots of knowledge on board, but this field of precision cancer medicine is constantly growing, constantly changing. There's new stuff literally every day to know. I don't know everything, but I do know a lot. So if you know something that I don't, share it here. I'm happy to share with everybody. You'll see as you go through the course, we have a number of different units, general information about what cancer is, how it forms. This is really important. It might feel like you want to just hurry up and get to the part about the treatments that you need. I'm going to invite you to pause, take a couple of deep breaths, and know that while this is very critical, this is super important, what you're dealing with right now, it's important to be well educated. It's really important to have a nice foundational knowledge of what cancer is and isn't, so that you can't get caught up in false hope and that you know how to tell what a fact is and what a fact isn't. That's going to make a huge difference when it comes time for you to speak to your doctor and ask for them to modify their standard of care program to something that's going to be more beneficial for you. The more confident you are in your knowledge and the more accurate your knowledge is, the easier it will be for your doctor to get on board, okay? And also, of course, the more confidence you'll have and the better outcome from your treatment. So you might want to skip units. I totally get that. You do you. My advice is just pause, take a breath, and you just play the video in the background while you're making dinner, okay? The more that the information gets into your noggin, the easier this whole process will be for you. And what that really means is the more effective your treatment will be and the better the outcome for you. As you go through this course, you'll see that there's videos, there's written exercises, there's quizzes for those of you who like that kind of thing. I happen to, so I threw those in there. And lots of room for you to ask questions. Don't hesitate to throw a question. There are no stupid questions here. This is critically important stuff. Anything that isn't making sense, again, ask about, but also just for your own personal case. Share a little bit about what type of cancer you have, what stage you're at, what kind of treatments you've had before. Maybe what kinds of things you really want to know most about in the context of your specific case. Please just use this program as a safe place for you to just share what's happening for you and what it is you need. In addition to the content that you'll see in all the different units about cancer, cancer diagnostics, cancer treatment, there's a unit about self-advocacy that we're just working through right now. Some of you, of course, it'll be there when you come to the course, and about alternative therapies. What does the science say about what we can say for sure about certain of the most common alternative therapies and what's still a question mark? Again, our mission is to make sure you're as well educated on all of the bits to do with cancer treatment. And that's not just the stuff you might get at your cancer agency, but the things you might explore with a naturopath or alternative therapy provider, as well as your self-care and your mental health. We're going to cover it all here. One last piece, we have some drop-in Zooms for you. We have an office hours Zoom with precision cancer medicine expert Alexander Rolland. So once you kind of know what it is that you're wanting to action on, whether treatments or diagnostics, I'm here to help you take that action. I'm here to help you get around any of the barriers in your mind, like what if my doctor's not happy? What if my doctor's mad that I'm asking for something that they don't normally want? How do I even approach my doctor about this? What is the paperwork I need to get together to get my doctor on board? All of it. I'm things like, what about my family? What do I share with them? And if you're enrolled in this course, you will get regular emails from us reminding you about these Zoom calls, and they'll have the days and times and links in them. So don't feel like you have to remember. You'll be notified as these things unfold. I understand that cancer is stressful, whether it's you or a loved one you're here for. You've got lots going on right now. It's not easy to remember things when you're stressed. We're going to take all the heavy lifting off your plate and make it really easy for you to get the information you need. So let me know how I can help you, and I look forward to seeing you in our live Zooms and to answering your questions as you go through the content.